Welcome back. Some doctors are calling on parents to keep their kids at home when they're sick. Dr. Kams Govender, a general practitioner at Hillcrest Value Health Center, is one such doctor. He says school-going children will be the initial driving force behind the third wave. Now, we're seeing it peak in some provinces. This follows the death of 2 young girls in KwaZulu-Natal. Let's speak to Dr. Kams Govender now. He joins us live. Doctor, thanks for your time. We appreciate it. So, when it comes to children, the experts are saying that they're not high risk, that the risk of death is almost minimal. But what are you saying, given that we've seen 2 children die in KwaZulu-Natal after contracting COVID-19?
So, yeah, thanks, Shahan. So what we've seen recently over the week, there's a number of children testing positive, the trend being more in the primary school. But, at the same time, the children that I've seen so far, a lot of them have recovered fully, within 3 to 5 days. This was symptomatic treatment. So very unlike the second wave, where most of the kids that were tested positive were asymptomatic. A lot of the kids that we're seeing now are coming in, presenting with high fevers, most of them with upper respiratory tract symptoms. And so, the difference now is most of the children that we're seeing are highly infectious, and that's the reason we ask for children that are symptomatic to stay at home, just to try and curb the transmission in schools that we're seeing at the moment. There's quite a few schools in KwaZulu-Natal that have been identified as hotspots at the moment. So, like in the second wave, I think, when we looked at policies and action plans in the workplace, we also identified individuals that were so-called high risk in terms of, severe complications and mortality amongst adults. So also, I think we also need to look at that amongst our children. I mean, there are a lot of kids also having comorbid conditions that we need to look at that also predisposes them to more serious complications and mortality around COVID-19.
Yeah, that is key, right? Because it's comorbidities, even with children. Mm-hmm. I think that is concerning. And that's where parents need to basically make the decision as to whether or not their kids should go to school. So what's your advice to parents whose children perhaps have asthma or any other comorbidities?
I think it's important, we need to individualize the kids also. I think in the second wave, when individuals or adults had comorbid conditions, they went to the general practitioners and they got letters stating that, based on the comorbid conditions, they're high risk from a mortality point of view. And I think also, at schools, I feel sorry for our kids. They had a lot to bear over the last 2 years. I mean, our kids need to be schooled. They need the social interaction. They need the physical activity. And even anxiety in children have increased about 10-fold. A lot of kids have lost their parents, loved ones. So there's a lot that our kids are also dealing with from an emotional point of view. So I think, the parents that have kids that are so-called high risk in terms of, risk factors should also look at, especially kids that are type 1 diabetic or other immunosuppressive disorders that put them at risk for mortality or more severe complications. I think, it's very important to have a very, proper policies and also action plans regarding schools, and kids that are so-called high risk might be exempt might have to be homeschooled while the numbers are very high, and then might be returned back to school. But I think, Shahan, that's very important to have proper policies, especially around COVID-19 in schools, and also identifying high-risk kids. And just like what we do to adults, I think, the high-risk adults were allowed to work from home. So I think once you have proper governance and policies and also action plans going forward, I think we were able to make a more definitive or in terms of how we're managing high-risk kids at school.
So, Doctor, let's talk about what you're witnessing in KwaZulu-Natal, because we're seeing you currently the epicenter. We're seeing new infections in that province peaking. In fact, apparently it's going to last for 3 weeks. As a general practitioner, because we normally speak to staff at hospitals, etc. As a GP, what are you encountering?
So yeah, we're seeing quite an increase in children, and I think children are going to be the driving force behind the third wave in KwaZulu-Natal at the moment, because most of the primary contacts are children, and now we're seeing parents that are being infected. And just in the last 24 hours, I had to admit 2 parents with the comorbid condition into hospital because of complications from COVID. So. I think also the way we manage COVID in school, how effectively we manage or try and contain COVID in terms of early diagnosis, isolation of children that are affected, close contact tracing will have a huge direct impact on the transmission rate in our communities. So, so the numbers are rising quite, it seems to be rising quite quickly, and we're seeing a lot of children symptomatic. I think the reason for that is that in the first and second wave, I think in the first wave we had a hard lockdown. Second wave, most of the schools were closed, but now our schools are opened, and we're seeing a lot of children testing positive, and I think that's going to be the driving force in KwaZulu-Natal over the next few weeks.
All right, thank you so much for your time and the work you're doing. Dr. Kams Govender, a general practitioner at Hillcrest Value Health Centre.